Hi there, it is a Wednesday, it is Mansfield today, and that means we look at things medical. And welcome into the Mansfield Today studios, our resident GP, Dr. Vicky Skitter. Nice to have you with us, Dr. Vicky.
Thanks for having me.
There a fair amount of questions have come through relating to COVID and comorbidities and all the rest of it. And we thought it may be an idea just to have a look at one or two of those over one or two of the next shows.
Okay.
One of the ones that you've seen. Old age is also a comorbidity because then otherwise I can't see what's on my screen and read the emails. This one from Fiona. She says she has hypertension. What is hypertension?
Okay, so hypertension is high blood pressure.
Okay.
That's usually when your blood pressure is consistently over 140/90. Now, people often say, what's the top one and what's the bottom one? So the top blood pressure is when your heart contracts, and the bottom one is when your heart relaxes.
Okay.
Okay, so if the top one is 140 or over and the bottom one is 90 or over, you normally can diagnose hypertension. You can't just diagnose it at first visit.
Mm-hmm.
You have to go and visit your GP, who will welcome you into her rooms. And then you need to be relaxed for about 5 minutes. Lie down or sit down, arm at sort of heart height. And then you would take you'll take a few readings, not just one. And then if there's a difference between the two arms, you'll take, both arms. If there's a difference of 10 millimeter mercury between the two arms, then you'll take the higher reading on the higher arm. But that still doesn't diagnose hypertension. So because everyone's a bit anxious, or they might, have screamed at someone in the traffic on their way there. So you'll then send them home and ask them to do home monitoring for about 2 weeks. So you'll take a blood pressure reading in the morning when you wake up, so that will give you an idea what the blood pressure was overnight. And you'll take one later in the day, it doesn't really matter what, but you can't run in from work, sit down, scream at your children like I do, and then take your blood pressure. You have to sit down calmly and wait, and then take maybe 1 or 2 readings.
I can imagine because I don't like doctors' rooms. You know what I mean? I don't think any of us like going into a doctor's rooms. I'm sorry to tell you this, doctor. I know that I don't want you to sit there and watch every patient walking in thinking the last place this person wants to be is right here with me.
No, who likes go? I don't like to go to the doctor either. It's not nice.
Okay, right. I'm glad
I
to hear
understand,
that.
yes.
How does a doctor choose what doctor they're going to?
That's a hard one. We've got friends. You always phone a friend.
So I think your blood pressure is normally just a little bit up because you are not feeling that.
So we call it white coat hypertension.
White
I don't
coat
ever wear a white coat, but we still call it white coat hypertension. And it's very, very common. So you'll often do blood pressure and the patient will sit there with groot oë and think, oh my gosh, my blood pressure is so high. But rather, relax, go home. Most of the time, it will probably be normal at home.
Yeah.
You also get a monitor, 24-hour monitor that they stick to your body, basically to your arm. And it reads 24 hours, it reads blood pressure all the time. So it can be a little bit expensive or it costs money. But it's also uncomfortable. You sleep at night and it blows on your arm. And
No.
I don't like that too much, but I prefer. But if you find a patient with a blood pressure like high, like 160/100 or over, you would like to make the diagnosis a bit sooner. So you'll probably send them home for 3 days or so, bring them back and check all the readings, and then you can make a call.
What are the causes of hypertension or high blood pressure?
So you get primary hypertension, where you don't really know what the cause is. It's 90 to 95% of patients have primary hypertension. So it can be related to lifestyle and genetics, but there's no real cause. So the secondary hypertension patients, they have a cause, and that's usually renal problems, renal failure, kidney disease, that's what I mean, or other hormone issues like high cortisol levels or thyroid issues. So the primary hypertensive patients often say, now, why did I get it? Why did I get this? And you say, I don't know. You know, it's it happens. It just clicks and happens.
Well, speaking of hypertension, we've got a mail in. And by the way, you're quite welcome to send us mails with any questions that you may have about anything medical or any suggestions that you would like us to handle on this particular show. All you need to do is drop us an email and we'll pass it on to Dr. Vicky. The email address for this show is medical@mansfieldtoday.com, as you see there on your ticker tape right now. Jeff down in Cape Town, also talking about hypertension, he said, apart from drugs, how do you treat this?
Okay, so obviously most people don't want to be labelled with a disease and then take pills for the rest of their life. We understand that. So there are quite a few things you can do. Look, if you're overweight, then the best thing is to lose weight. Really, that's the best thing for most diseases. If you're smoking, then obviously you should stop smoking. If you're not doing enough exercise...
I'm just holding my breath here.
They say you should do brisk walking for 30 minutes most days.
Mm-hmm.
So maybe if you're at work and you can't do it at home, you just run up and down the stairs. I'm not sure, but you need to be active. Just sit still for long periods of time is not good. High salt intake, lots of caffeine, any stimulant. So patients are, some of them don't want to come and tell you they're on appetite suppressants. Those things can increase your blood pressure and your heart rate. Or if you're doing drugs like amphetamines and cocaine, eating healthy food, losing weight, those are the most important things.
So it's really, it's a lifestyle that you've got to adopt.
Yeah,
what you eat, how you exercise.
Yes.
Interesting
enough, I'm just thinking of the two things that are associated with the risk factors for hypertension is depression and loneliness.
Oh, really?
Loneliness, that's sad.
Yeah, but you know what? That may be one of the reasons why we had such a response to comorbidities and all the rest of it around COVID.
Yeah.
Because I would imagine that there are a lot of people who have a sense of loneliness right now.
I'm sure.
Because of the situation that we're in.
I'm sure.
And you'd probably find a spike in hypertension
probably.
as a result of that.
And stress as well, hey?
Yeah. I believe one of the major hospital groups is busy building or looking at building rehabilitation centers around the country.
Yes.
But they are specifically for depression.
Yeah, I can imagine.
That may be an idea. We should maybe at some stage get somebody in who could talk about rehabilitation centers, because I never knew this. They evidently are built to different specs. So if you have an alcohol rehabilitation center, the specs for it are different to a drug rehabilitation center.
Okay.
They are different to it for
sense.
a depression rehabilitation.
Yeah.
So maybe we should get somebody in to talk about that.
Yeah.
But this is me just waffling on.
Okay, no,
Let me rather just get back to the emails. And we're also running out of time. This was one of the interesting ones from Bongi, who wanted to know if there are any side effects to the medications.
There could be, let's say it could be. So don't be put off by it because there's lots. But if you take, say, diuretics, which gets rid of extra water in the body, basically, they can sometimes cause a dry mouth or dizziness. I mean, there's a host of things. The one that's very common from calcium channel blockers, just this one, is swelling of the ankles. Mm-hmm. Some can cause, and specifically that one as well, can cause nausea, constipation, and beta blockers that slow down your heart rate can also cause a bit of dizziness, and some of them can drop the blood pressure a bit low. It doesn't happen often, but it can. And then you obviously do get dizziness and, you know, you don't feel so well, or tiredness. But the patients, you know, don't look at don't get your medicine and then look in the package insert and read through all of this and now you're getting all the side effects. I mean, you shouldn't get those side effects, but if you do, we change you to a different drug. So it's not that difficult.
How often, ideally, should you be getting your blood pressure checked?
Well, every time you go to your doctor, I think you should definitely have your blood pressure checked.
But if you're a healthy person like me, who never has to go to my doctor...
Yeah, but see, now, this is a silent disease, so we call it the silent killer. You see? So 70% of patients with a first heart attack, stroke, or heart failure do have high blood pressure. So you won't know until you check it. So often it's mostly diagnosed or seen by accident almost when you go to the doctor or whatever. But if you don't go to the doctor like you say you're all healthy, then probably maybe twice a year.
Okay.
Especially if you're over the age of 45, which I'm not, but you know, you should go. I'm joking. No, sure, I'm joking.
There we go. No, you're absolutely right. There we go. I have to leave it. Dr. Vicky Schutte, thank you very much for joining us in the Mansfield Today studio. One of the other topics that we've had a fair amount of response to or questions about with regard to comorbidities, and maybe this is something we can look at next week, is diabetes. So, doctor, go do your research.
I will.
Dr. Vicky Schutte, our resident GP on Mansfield Today. That's it. Tomorrow we're talking travel. Andrew Stark from Flight Centre is going to be joining us, and we are going to see what's happening on the travel side. I believe that he also is going to be able to announce some further good news in the travel industry. So look forward to that tomorrow with Andrew Stark and our friends at Flight Centre, right here on Mansfield Today. Until then, bye-bye.